So I'd like to introduce Ms. Ho. She's a senior speech and language therapist with the Dyslexia Association of Singapore. Her clinical experience includes working with children between the ages of 5 and 16. She enjoys working with parents to develop children's speech, language and communication skills. She conducts social skills workshops as well during the holidays. She gives talks on speech, language and communication difficulties faced by children with specific learning differences. So we would now like to invite Ms. Ho Shuet Lian to present her research on speech and language therapy helps dyslexic children achieve.
Thank you, Puva, for the compliment. I think right now in Singapore, because we have limited number of speech and language therapists, so that's why, people would want to see more of our faces. Okay. Yeah. So today I'm going to share with you. It's a pleasure, okay, to share with you the distinctive speech and language needs of children with dyslexia at DAS, as well as how speech and language therapy helps them to achieve. Okay, so before I share with you the study which our team had done last year, I give you some background information. So currently, speech and language difficulty, the newest terminology is actually SLCN, so speech language communication needs, and this is commonly used in UK. Okay, so it is one of the most common childhood disability. So the Communication Council in England did a statistical study. So it reported in September 2014 that 10% of the children in UK have a long-term speech, language, and communication needs. So similarly, at DAS, we found that approximately 10% of the student population at DAS have speech, language, and communication needs too. So they are being referred to attend speech and language therapy to help them to improve their communication skills. So these children normally, they will have academic, emotional, and behavioral difficulties. So there's a paper written in 2012 by Lindsay et al. Found that only 3% of the student population is ever identified as having SLCN. So what does this mean? It's actually in UK, many cases have fallen through the cracks, which I believe that in Singapore is the same thing. It's just that we don't have a local stats to show. Okay, so what I want to share with you is the relationship between oral language, which can be supported by speech and language therapists, and written language we call literacy, which is supported by DAS educational therapists. So in typical developing children, oral language develops before literacy. Okay, so that's the relationship. More information on this. In 2009, the Department of Education and Early Childhood Development in Melbourne published a book called the Language Support Guidebook. So in the book, it states that oral language underpins literacy. And this means that oral language is the primary language mode, and the student's ability to understand written language across curriculum is dependent on their oral language ability. In the following year, the American Speech Language Hearing Association issued an official policy statement, which states that speech and language therapists do contribute significantly to the literacy achievement of children with communication disorder, as well as other learners who are struggling or at risk of struggling in school setting. So DAS recognizes this relationship, and hence the organization has started a speech and language therapy service in year 2009. Okay. I'm going to share with you briefly what do the speech and language therapists at DAS do to help children with dyslexia. So we work on their work on their listening skills by strengthening their phonological awareness and also improve their auditory memory. We also work on their critical thinking skills of conceptualization, problem solving, reasoning, as well as predicting outcome. So we also work with them on developing their speaking skills by teaching them a variety of sentence structures, how to make a request, how to explain something, and also to describe something. Okay, so all these skills are critical in helping these children to assess the literacy curriculum. And I believe that this morning the key speakers and some of the speakers in the session, more or less, they are talking about all the skills. Okay? So the SLT team, Speech and Language Therapy team at DAS, we did a study last year. So 35 students aged between 7, P1, and 16 years old, Set 4, were randomly selected to evaluate their progress. So 80% of the participants were males. All of them received 1 hour weekly individual therapy for at least 2 consecutive terms of 20 weeks. So we found that 53% of the participants required remediation on their expressive language skills. So this means that they needed support to improve the way they communicate and speak. So an example of expressive language goal is to use the word because in a sentence to express the cause and effect in a situation. We also found that 34% of the participants required help to improve on their ability to understand and instructions. Okay. A typical receptive language goal is to be able to understand and follow simple 2-step instructions. So 3% of the participants needed support in terms of working on their pragmatic skills. So pragmatics refer to the ability to master the rules for social language. Example will be having good eye contact during conversation, and then being able to do good turn-taking in group activities, as well as using appropriate speaking volume in different social situations. Okay. So we found that 60% of the participants, they achieve 90% or more RIP goals set at the end of the school term. So RIP goals stands for Individualized Intervention Goals. Okay, so we customize the program for specific to the needs of the children. Okay. And we found that 6% of the participants achieve less than 80% of the RIP goals set. So we went to analyze the learning profile of the low achievers, that means the 6%. So we found that one of them had severe dyslexia, and the other participant had multiple learning difficulties of dyslexia, language disorder, auditory processing disorder, as well as impaired pragmatic skills. Okay, so this result actually suggests that the complexity and severity of the learning difficulties would definitely affect one's rate of learning and performance. Okay. So phonological awareness had the highest success rate of 90%. So possibly because phonological awareness is the foundation skills for word recognition and spelling, as well as the skill develops as early as very young age of a 3-year-old with accelerating growth at the 4th and 5th year. Okay. So we found that pragmatics had the lowest success rate of 70%, possibly due to the insufficient or lack of reinforcement of the target behavior. For example, if the child is working on maintaining good eye contact in a conversation. So it's like outside speech and language therapy, adults were unable to reinforce the same behavior at home or in school. Okay, so this also suggests that, if adults are able to reinforce the same target behavior in different social situations, the child is likely to master the rules for social language quickly. Okay. So all the participants were told to rate their self-esteem before and then after therapy. So we found that 49% of the participants rated their self-esteem as higher post-intervention. So this suggests that speech and language therapy had helped them to improve their self-esteem. On the other hand, 40% of the participants rated their self-esteem as lower post-intervention. So one of the possible reasons could be after attending the therapy, the children were more aware of their shortcoming in their speech, language, and communication skills. So hence they think they weren't as good as they thought they were, okay? And when we asked the participants to rate their self-esteem, it was also the same time that the participants received their school exam results. So some of them could be emotionally affected by the poor school exam results. So therefore, when you ask them to rate, how good they are, at that point in time, they didn't feel so good about themselves. Okay. Okay. So now I'm going to share a case with you. This pretty lady here is Jia Ying. She is 10 years old, P4. So she's diagnosed with dyslexia and moderate to severe language disorder. Currently, she attends MAP program, which is our literacy program, speech and language therapy, as well as speech and drama arts at DAS. So my initial impression of her is she was quiet and soft-spoken. When I had a conversation with her, she spoke very little and hardly initiated any conversation. I also observed that, she had this self-doubt behavior of after she answered a question, she would actually look at the adult for some form of acknowledgement. Yes, and sometimes she displayed anxious behavior, like when she was unsure of what to say, she sort of scratched or poked her arms. Okay? So my overall impression of her is she was someone with low self-esteem, not that confident of herself. Okay, so after working with her for 50 weeks in both group and individual therapy, not at the same time as that group already, after that I put her into individual therapy. Currently, she's vocal. Okay, and she initiates a conversation. She's able to share her ideas readily. She speaks audibly, and I hardly observe any self-doubt or anxious behavior. So overall, her self-esteem, self-confidence has improved tremendously. Okay. So similar feedback was given by her mother and school teachers. So her self-confidence has improved, and Jia Ying takes initiatives in learning, and then she's more interested in learning too. And her mother could understand her story better because her sentences make more sense to the mother now. Okay, so as the saying goes, seeing is believing. So we are going to watch a video because Jia Ying has something to share with us. So please note that she did not refer to the script when the video was taken. And the content, she came up with the content. So what I did, right, is just to fine tune her sentences, and also we did a couple of practice. Okay.
In Miss Shuet class is, it's okay to say the wrong answer. I learned from my mistake. I learned how to use action, adjective, and be to make a sentence. I understand more words now. I am braver than last time. I will try my best and never give up. Children, don't be afraid. You will overcome your fear of talking to people when you keep practicing or trying.
Okay, so that's all I have to share. Today, I have the privilege of inviting Jia Ying, because she's actually in this room, to come out on stage to say a few words. So can you give her a round of applause?
Hi everyone, my name is Jia Ying. Thank you for listening to my speech and have a nice evening. Bye bye.
Okay, so it's like, what we learned in June's session this morning is like, to praise her for the effort is, it's very brave of her to be, come out on stage and then just to deliver a few words, okay? So with this, I want to praise her for her bravery. Okay, okay, yeah, you can go.